Welcome. This conversation is part of a prevention and education initiative in response to the opioid epidemic in communities of color, particularly in disadvantaged communities and the African American community. I'm Madalynn Rucker. I'm Executive Director of ONTRACK Program Resources. We've been serving for over 20 years, supporting efforts of communities, public agencies, nonprofit, and behavioral health service providers to increase the opportunities and access for high quality treatment and recovery services. Joining me is Roland Williams. He's an international renowned addictions expert, counselor, author, and trainer who we have worked with over 20 years, and I'm very proud to introduce him into this conversation. Welcome, Roland. Good to see you.
Thanks, Madalynn. Good to see you too, always.
So, what is the current reality of opioid addiction in African American communities?
Well, you hear a lot of talk about the opioid epidemic and opioid crisis, and in my experience, and I've been working in this industry for the last 34 years, in my experience in the African American community, there's always been an opioid crisis. You know, African Americans have been impacted and affected by opioid addiction in the 50s, the 60s, 70s, and primarily the opioids of choice were heroin. Not the prescription medications that we're seeing today. It was heroin and cough syrup with opiates in it were commonly abused in the African American community. And I don't think it became an epidemic until it reached the suburbs. And when it got to the suburbs, then all of a sudden it became a crisis and an epidemic. But I think the African American community has struggled with heroin and opioid addiction for decades.
A lot of the focus concerning opioid addiction is on medication-assisted treatment. What is MAT, medication-assisted treatment? Is it a viable option for African Americans?
Absolutely. Well, first of all, what it is, medication-assisted treatment, sometimes referred to as medication-assisted recovery, comes from this idea that addiction is a brain disease. And as a result of that, part of the treatment ought to be a biological kind of treatment. And so they've discovered that there's been many drugs that assist people in their treatment, episode. And particularly related to opiates, there's medications that are used to help people manage withdrawal symptoms, cravings, and even replace the opiates. And that's what we've been seeing with medication-assisted treatment. And there's been a lot of money invested in medication-assisted treatment over the last couple decades. And yes, it is a viable option for anybody who has an opiate addiction particularly.
And what holds people back from seeking treatment for opioid addiction?
Well, there's a couple of things. One is access. Do they have access? And because many of the opioid addiction, the medications used in medication-assisted treatment are, you need insurance to get them, unless you're using methadone. And methadone, you could get methadone from the county if you've got Medi-Cal, and sometimes you don't need a private insurance to get methadone. But a lot of the other drugs like the buprenorphine, the Suboxone, the Subutex, even the naltrexone drugs, which are all used in the opioid for treating opioids, those drugs, you're going to need private insurance. So a lot of people don't have the private insurance, and that's particularly in an African American community. And then there's a trust factor. What we're seeing a lot now is a big push to get people on maintenance narcotics, and these drugs that are used are actual narcotics. They're opioids themselves. And so a lot of people are hesitant to go from one drug to another drug that both have a addictive quality to it. So there's access, there's insurance, there's a trust factor, and then the way they've been used. Like I said, they're great for I didn't say that, but they're great for detox, but the real push is to use them for maintenance. And a lot of people don't want to be on maintenance narcotics.
Thank you, Roland. We're going to continue with part 2 of this discussion and go a little deeper into the benefits and the pros and cons of opioid treatment through medicated assisted treatment. Thank you.
Thanks, Madalynn.